In a state where healthcare meets hardship, where daily life is a struggle for survival amidst conflict and deprivation, one agency is quietly rewriting the story, with thousands already enrolled and more joining each day. The Imo State Health Insurance Agency is bringing healthcare within reach.
The primary vision of the agency is to ensure that people in Imo State can have access to basic medical needs in the state without suffering financial hardship.
From the crowded markets of Olo to the rural hills of Okigwe and the city of Owerri, Imo State Health Insurance Agency is restoring hope one patient at a time.
But if your wife is enrolled, the agency will definitely pay for your wife's cesarean section because it's part of the mandate of the agency. Our implementation is not political.
It is purely designed to serve the good people of Imo State, and they should make use of this opportunity. Okay, so thank you very much for your question. As you said, my name is Dr. Uchenna Ewelike, and by the grace of God, I am the Executive Secretary and CEO of Imo State Health Insurance Agency. Prior to my appointment by His Excellency Distinguished Senator Dr. Oku, the Governor of Imo State, I was a senior management staff of the National Health Insurance Authority, and I am currently in Imo State on secondment after being released by the Honorable Minister of Health on the request of the Governor of Imo State to come and implement health insurance program here in Imo State. So that's why I'm here. The primary objective of setting a financial risk protection agency as we have in Imo State Health Insurance Agency today is to protect people from catastrophic health expenditure, so that people can have access to quality health services in event of need. And the primary vision of the agency is to ensure that people in Imo State can have access to basic medical needs in the state without suffering financial hardship. And that is in line with the reform objectives of the Governor of Imo State to ensure that access is improved, not just in the rural community, in the urban communities, but with a lot of emphasis now in the rural communities. So you can hear over the time now that the governor is principally the vanguard of the agency. He goes out on his own, telling people on the importance of financial risk protection. And let me quote him, that 85% of all the deaths in the state are prevented. And I think it's also a very good thing for us, because it deepening the conversations on financial risk protection. Because yes, one of the greatest challenges people have is access. And the major reason to access is financial access. Many people are sick, but they can't go for any detection of the illness. They can't go for treatment because they don't have access. And why they don't have access is because they don't have the resources to be able to access healthcare. And that's what the government is providing to ensure that people can have access without suffering financial hardship. So that is part of the broader vision of the Governor of Imo State, to ensure that people can have access to health service. As you know that the implementation of health insurance in the state is not political. Irrespective of your political biases, irrespective of your religion, ethnicity, tribe, gender, health need doesn't discriminate. If you are Yoruba, you are in Imo State, you can be sick. If you are an Hausa, you are in Imo State, you can be sick. So if you are of the APC, you can be sick. If you are the PDP, you can be sick. If you are the Labour Party, you can be sick. So in terms of implementation, it is not political.
So because the implementation is not political, when we go to these communities, irrespective of the level of security challenges, they allow us to implement our programs. So we're implementing in all the 27 local governments and 305 INEC wards in the state, and nobody has disturbed us. As a matter of fact, in some of those, in quotes, security challenged communities, the people in those communities welcome us and allow us to implement our program because our program is aimed at improving their livelihood and they're happy about it. Imo State has 27 local governments, 305 INEC wards, and 656 communities. We are implementing in all the 305 INEC wards, but with the broader vision of the governor to expand access on what we are currently doing. As I speak to you now, the staff of the Imo State Health Insurance Agency are all in the field doing enrollment. That enrollment is to enroll 2.7 million Imo residents into the Imo State Health Insurance Agency at 100,000 enrollees per local government. That gives you a total of 2.7 million because we have 27 local governments. And this enrollment is taking place in all the communities in the state with the active participation of President Generals, community leaders, captains of industries, councillors, local government chairmen, political and non-political actors who are now helping to galvanize the enrollment processes in the communities. We are currently in the third week of enrollment. Enrollment is still ongoing. We have done a substantial number so far, considering the target we have for a total enrollment process. So in a couple of weeks, we'll conclude that exercise and we'll let more people know how far we've gone in terms of that enrollment. So that is a broader way of ensuring that irrespective of your location in this state, you should be able to have access to health services, and we are currently on it. The person that we just operated on Saturday, I can recall, is one young lady, right? Yes. She had the enrollment done here, and we have operated on her. So it's part of what we're doing. That case you have seen is just, yes, she said that she went to a place and they asked her to bring 1.1 million naira. So, yeah. But the Governor Help Uzodima's program has done it for her at 50,000 naira. So this is what we have done in the state. I can comfortably tell you that we have managed 438,464 cases in this state in 2.5 years. And because you're able to know about this as a media person, that's why you're able to know about that particular case now that is currently in the hospital. It is across the length and breadth of the state. Just last week, in that same hospital where she's currently now, we had about 5 surgeries in one day. And in virtually all the accredited hospitals we are using currently, it's filled up with Imo State Health Insurance Agency enrollees as we speak. We have partnership with World Health Organization. But what World Health Organization provides for us is technical assistance, not financial assistance. It's technical assistance in terms of designs, evaluations, monitoring, and improvement on the quality of care. But the entire program is fully funded by the Imo State government under the leadership of His Excellency, Distinguished Senator Hope Uzodima, and some funding also that comes from the federal government, which we call the Basic Healthcare Provision Fund, which targets people in the rural communities, people who I would consider vulnerable population. So, but the entire funding, which encompasses civil servants, pensioners, and some greater population of the vulnerable people, are fully funded by the Imo State government. The health insurance program in the state for those in the informal sector population has passed through a well-designed, well-thought-out actuarial analysis. In health financing, actuarial analysis is what we do to determine prices for premium in a certain population. That has been done here in Imo State with the support of global partners who are experts in the industry, and were able to arrive at 15,000 naira per person per annum. Despite the inflation, we're able to break even and continue implementation because of the additional funding that is coming from the government of Imo State. So that's principally what we are doing now. Irrespective of the current socioeconomic status, health generally is not free anywhere in the world. It's either funded by the state or funded by the individual. It depends on the model, which we call either the privilege model or the Bismarck model. But what we are doing here in the state is a mix of both models, where individuals can also contribute, but the most vulnerable in the communities are funded by the government, so that it becomes equitable. Irrespective of your class, you should be able to have access. So it is priced at 15,000 per person per annum, and we believe that with the massive population coverage we are trying to do now, we'll be able to break even. And hoping and praying to God that the risk doesn't come so much. But with what we are seeing in the field now, we're a bit scared because we are seeing a lot of bad risk. We believe that with our knowledge in the industry, we'll be able to pass through that. Provided you are sick, if you go to the hospital, you'll be attended to. We currently have, that's what I'm telling you, that those who are enrolled under the Basic Healthcare Provision Fund, in that program, we have had a lot of successes, we have had a lot of interventions done in the communities and all that. For that program alone, we have had over 2,000 assisted deliveries, many of them are cesarean sections. And you know what it costs to do one cesarean section in the country, including myomectomies, hysterectomies, ovarian cyst removal, like we have done for the patient that you just talked about. So that's come from the subsidy that comes from the federal government and the one that also comes from the state government. You know that because health is a case of uncertainty, we don't know when we'll be sick. And whether and when we'll be sick, we'll also have the resources or not. And the emphasis on ensuring that we have an equitable fund that takes care of the most vulnerable is because the most vulnerable may not survive health challenges without access. But those who are a bit well-to-do will always find their way to the hospital. So the emphasis is to ensure that those ones that in event of illness, they can never have any access. For instance, a woman in Osu who is having obstruction in labor. And cesarean section in this country today is above 500, 600, 700,000 naira. And the husband will be scared to go to the hospital because the husband will feel that he will be asked to pay a certain amount of money. So in event that there is no intervention, definitely the woman will die. So those are the ones that will prioritize. Unlike maybe the wife of a big man here in Owerri, who in event that is an obstruction, the big person will take the wife to the hospital and the woman will be sectioned and baby will be delivered. But that, in that rural community, that is considered vulnerable and poor. So those are the ones that will prioritize. And this prioritization has no political affiliation. In as much as you are IMO resident, you will be protected. And we've been doing that since April 1, 2023. I've just given you data. We have managed 438,464 cases as we speak now, because I just collected this data from Data Emit this morning. So that's to tell you that a population of about 5.8 million people, we have managed over 500,000 cases. close to 500,000 cases. That tells you that we have drastically dropped out-of-pocket expenditure in the states, as the index case is part of it.
And we'll continue to do that. Let me tell you, one of the greatest successes we've had as an agency is our inroads into the reduction of maternal deaths in the states. We have done exceptionally well, even without collecting the data, which we do every month. I'm sure you're no longer hearing that a woman who was giving birth in one community, she died. The reason is because we have trained all the OICs implementing our program in the 305 INEC wards of the 27 local governments. They have been trained to be able to identify high-risk cases and refer for emergency interventions. And that's why we're recording a lot of successes. As at today, in less than 2.5 years, we have done over 2,000 assisted deliveries. So that tells you significantly, these are hitherto cases that would have ended with mortality, and we have significantly dropped maternal mortality in these states. The records are available for people to verify. Well, the mandate of the agency is to provide financial risk protection, which is the demand-side financing in health. The responsibility of care of the healthcare facilities does not lie at the Imo State Health Insurance Agency. It is the responsibility of the Imo State Primary Healthcare Development Agency and the Imo State Ministry of Health. Our responsibility is to accredit those facilities, both public and private, and see their suitability for use to purchase health services. However, if the facility is not good enough for us, we will not be able to accredit that facility and use that facility, because the insurer is the owner of the patient. I can take the patient from anywhere to another place. Just on Saturday, I moved one of my patients from a highbrow facility to another place because that patient wasn't getting the need and the expected healthcare attention that I wanted as a doctor. I had to move that patient away. And the patient is in a new facility where I have a better neurologist who is currently taking care of that patient, and the patient is doing very well. So what is important to us as purchaser of health services is, where do we get the desired quality services? I can get it in both public and private facilities. To be very frank to you, I'm sure you were not hearing this agency 3 years ago. This agency was set up in 2018 by an act of the Imo State House of Assembly and was assented to by the then governor of Imo State. But I can confidently tell you that the full operationalization of the agency started about 2.5 years ago, when the governor of Imo State took special interest to use it as a vehicle to expand access to Imo residents. And the public trust and confidence is purely because our implementation, one, is not political, is built on efficiency because we have the technical capacity to implement. And most importantly, we also have the political support, which brings in the funding to implement. And we've lived up to expectation that today, private individuals, people living abroad, just yesterday, we just finished an enrollment in the Ebuama community in Ogota local government. These are people who live in the US, but they paid for 300 and something of their family members in their communities for us to enroll. We just concluded the enrollment of MBC people in the US in the 3 local governments in MBC. They're all fully paid and they have commenced access to care for a long time. So in private individuals, people who live in diaspora, people who live in Lagos, people who live in Abuja, are now enrolling their family members, their relatives, their loved ones into the health insurance program. Because in all circumstances, health insurance still appears the cheapest,
most convenient way of accessing health services, because when you have insurance, first, access is guaranteed. You'll be able to see your doctor and a diagnosis will be made for you to start planning on the treatment modality. So we are very happy with the confidence that we are building amongst people and amongst the communities in Imo State. But most importantly, again, it's, we are not politicians. From this side of the implementation, we are not politicians. We are technocrats. And as a technocrat, our reputation is part of our growth. So we don't play with that, and we are confident that why more people are coming on board is because they have seen trust, they have seen things being delivered. It's a seamless process. Here we don't work like normal government work, where you are carrying files up and down, a lot of bureaucracies. No. If we identify those challenges, the way we have trained our line officers from the states to the local government, from the local government to the wards, from the wards to the health centers, they have all been trained in the culture for identifying cases, knowing when to intervene and intervening. Many of the cases we manage, I don't even know them. I don't know where they come from. I don't know where they are. But all we know is that we're implementing the vision of the governor of Imo State to make sure that people can have access to health services. Because insurance is a trust business, and when the trust is eroded, it affects the outputs in service delivery, and also demoralizes the enrollee. So one of the things we have done is to first train the healthcare providers on the modalities of the implementation. Of which many of them have keyed into that. Secondly, is that here in the agency, we developed what we call the Justiciable Service Level Agreement. This service level agreement enables all healthcare providers to be in agreement with our implementation modalities. And those Justiciable Service Level Agreement is prepared by a team of lawyers. So they know that it is justiciable, can take it to court. Because of that, they are more diligent and they are more circumspect in terms of handling the release of Imo State Health Insurance agents. We also have our call center lines in all the accredited health facilities, both primary, secondary, and tertiary facilities. So if you go to any facility that is accredited by IMSHIA, you will see on the dashboard our call center lines well displayed there. It is a product of the communications department and is well displayed there. So in the event that you are denied access, in the event that you are an enrollee, your name is supposed to be on the enrollee list and your name is not there, you can call IMSHIA who can verify if actually you are an enrollee or not. In the event that you feel that the quality of service you received is not optimal, you can also call IMSHIA immediately and IMSHIA will respond. We will not have staff in all the 27 local governments, 305 INEP wards and all the communities and all the facilities we're implementing. We don't have that luxury of staff. But we're trying to use ICT, we're trying to use innovations and creative ideas to be able to monitor our program.
How do we see or know some of the accredited facilities? How do people access them? How do people know where they are?
The accredited facilities are currently implementing. So word of mouth, people are also helping to disseminate the information. When they know that these facilities are accredited, they know. It's also on our website. The IMSHIA website, all accredited facilities are there. We also have some booklets where we have our accredited facilities. But however, every INEC ward in Imo State has an IMSHIA implementing facility. If you go to that ward and tell them, they even know us more than we know ourselves. You just mention IMSHIA. They will tell you that this is an IMSHIA implementing facility. This program is not new. People have been accessing this program since 2023 and they know the facilities very well. Just some days ago, we suspended a facility in a ward for not adhering to the principles of the implementation. The news is everywhere. The community leaders are running helter-skelter to make sure that their own facility comes back on board. So what it means is that people know about our program, people know about currently what we're doing, and no community wants to lose out in the implementation. So, but we also need more awareness. The agency doesn't have that luxury of fund. We're happy that you're coming pro bono on your own to come and interview us and disseminate this information and let people know what we're doing. So that's a good one, because healthcare is not like road infrastructure where you see that. You only see people healthy, walking up and down, being productive, and contributing to the growth of the society. But you know that it's an investment that has been done there. So we're happy that your organization is partnering to ensure that people can have more information on what we're doing. We're implementing there. So because you have not gone to the health center, that's why you have not known. We're currently implementing there.
So themselves should maybe do pair by spreading the message.
Yes, we see one thing is this. When government programs come, government must implement through people. Government is all of us. Now, when government has an idea, a novel idea, like what IMSHIA is doing, it is the responsibility of the people to disseminate the information so that the end users can maximize the benefit of this government intervention. Now, communities should also be able to create the awareness, get more people enrolled into the database of Imo State Health Insurance Agency, because it protects them more. Just as you are now, that if you are married and they tell you that your wife requires a cesarean section, nobody determines how a child will come. And all of a sudden, on the day of the cesarean section, you may not have the resources. Or if your wife is enrolled, the agency will definitely pay for your wife's cesarean section, because it's part of the mandate of the agency. Because if you are enrolled, definitely you are insured. Insurance means that you have entrusted these resources to this person. And the event that this happens to me, this person will take the responsibility. And that's what we're currently doing. So you can help us to disseminate the information more to irritated people and every other community in Imo State where we're implementing, to know that what IMSHIA is doing is to the benefit of each and every one of us. Enrollment is 15,000 naira per person per annum. So, in a layman's term, 15,000 naira per year for an individual. ENS does not determine who is rural and who is urban. So, it's an actuarial analysis that has been done for both rural, urban, and semi-urban. Honestly, with the way we are going now, on conclusion of this enrollment, I think we should have done almost 40 to 50% of IMO population. But our greatest desire as an agency is to protect the entire IMO residents. It may not be in the life of this administration, but at least we have set a foundation that the trajectory can be followed. But all things being equal, we should be able to do 50% before we leave. Mind you, we started from zero, and we have been able to achieve this milestone. So it's something to celebrate. Well, I think they are no longer skeptical from the data we have in the field, because they are saying it. Wait few more minutes, you see people trooping into this place to come and do enrollment. They are seeing the results. They are not skeptical. People who are skeptical are the politicians. That they think that the implementation of health insurance here has a political undertone. But that's a wrong mindset, because the essence of leadership and governance is to make life easier for the people you want to govern. So I think they are not skeptical, because our enrollment is increasing on the regular basis. People are coming in on their own, communities are coming, groups, associations, age grades, former classmates, and all that. So, and there are a lot of cohorts that are coming on board. But for those who are still skeptical, if there are, our implementation is not political.
It is purely designed to serve the good people of Imo State, and they should make use of this opportunity. Well, my expectations for the continuation of the implementation of the health insurance program in the state. But I must sincerely thank the governor of Imo State, His Excellency Distinguished Senator Obuzodema, for the opportunity first to implement these programs. Secondly, for the support to implement this program. I have been in this industry for a long time before I was seconded here. So I've implemented health insurance in and out of the country in terms of designing health insurance. The greatest challenge in implementing health insurance in Africa, in quotes, Africans feel it is not my portion. I will not be civic. So the greatest challenge in implementing health insurance in Africa is not technical skills, it's political will. Why you are hearing this health insurance in Imo State today is because we have political will. As of today, every civil servant in Imo State is on health insurance program, and the government is paying for them. As of today, every pensioner in Imo State here today is on health insurance program, and the government is paying for that. The bulk of the vulnerable people, we're also getting subsidy from the federal government to take care of them, and the one we're also getting from the states to take care of that. And he has given us a free hand to be able to implement for people to benefit from the program. So on that alone, I want to thank him especially for understanding that his people, the people he leads, need financial risk protection. And if you see the videos that come out from the programs, widows, widowers, young children, and all that, pray for him on a regular basis. Just like the girl in question. When that girl was living here on the day she came, we wanted to assess her vulnerability because her case is a case of bad risk. She already has a pre-existing medical condition and she wants to enroll. If it is private health insurance, they will not take her because she already has a pre-existing medical condition. But we have to take her because we are public. So do I know her political party? Do I know where she comes from? Do I know anything about her? So it is the work of government to ensure that you protect your people, because if you don't intervene, her kidneys are already beginning to get compromised based on the result that I saw. So we needed to intervene because it's a resident of Imo State. So this is what the governor has asked us to do, and we'll continue to do that. So on that, I want to thank him specially for giving this agency the latitude to operate. Our work here principally is the work of God, and that is what we do here. It's just to save lives, and we're happy to do that.
I'm happy meeting you, Dr. Uchenna Ewelike. Thank you, sir, for the opportunity to interview and then get some of these facts. We promise we'll do our best in ensuring that this message gets to people using our network, and we'll also give it to you so that I can also push to anyone and every platform that you have to make sure that more people benefit from this, because the Bible said, my people perish for lack of knowledge. So let's give them this knowledge so that they can as well perish, because one, they have it, like what happened to me, I was touched. And so because of that, I said, we must do this. We're doing other things, but I said, no, we must do this. I'm so happy, sir. Thanking you especially at taking His Excellency, the Governor, Senator, Distinguished Senator Obuzodema for this wonderful. You said it was started since 2018, and most people are now getting to benefit from it now. It's a wonderful thing. We thank you, thank the Governor, we thank everybody, all your team members. And also say, please, give us more in anything. We appreciate it.
God bless you, State.
Thank you, sir.